Vanakkam and welcome to Metier Academy, one of the leading academy in training nurses in nursing competitive exam as well as IELTS and CLEX and OET training. Welcome back to Magical Session. As you all know that in Magical Session, we are discussing previous year question papers. Not only that, we are discussing the rationale of each and every options and additional golden points. On the whole, we are covering each and everything. So watch the video till the end. Definitely, it will be so much useful for you. And if you like the video, please like and subscribe our channel. Please share the videos as much as possible so that everyone will get the benefit. So already most of the important topics and previous year question paper videos, it is streaming in e-nursing Metier YouTube channel. So watch those videos also before the examination. It will be so much useful for you for your examination, upcoming examination. Okay, so let's start the session with your thought of the day. If you can change your mind, you can change your life. If you can change your mind, you can change your life. So everything is your mindset, guys. If your mindset is towards your goals, definitely automatically the motivation will happen within you, the confidence will get developed within you, and you will go towards your goal. Okay, so everything is your mindset. So keep your mindset positive. Okay, so with this thought, let's start the session. See, as I mentioned already so many questions on the important topics we have discussed, and it is there in the e-nursing Media YouTube channel. Please watch those videos. Okay, and today we are going to start from the 21st video. A child is brought to the ophthalmology clinic because the parents notice a white reflex in the eyes while taking photograph with flash. While taking photograph with flash, white reflex in the eyes is seen by the parents. Okay, so this is the first segment. The nurse understands that this cat eye reflex is commonly associated with the which condition. Okay, so in a single reading, I understand the question. This is the first strategy. And in a single reading, I found out the key points also. So what are the key points? While taking the photograph with the flash, the parents saw a white reflex from the eyes of the baby. Okay, and they brought the baby to the hospital, and the nurse understand that this white reflex is nothing but cat eye reflex. So the last line is always very important. This is the third strategy. So in the last segment, what they're asking, this cat eye reflex is commonly associated with which condition? So these are the important key points. Okay, so the cat eye reflex is commonly associated with the which condition? For knowing that, you should know the rationale of each and every option. See, brush field spots are nothing but it is a white or grayish spot in the iris of the Down syndrome patient. Which patient? Down syndrome patient. You can see a white or grayish spot in the iris of the eyes. Okay, so that is called as what? Brush field spots. Brudensky sign, you all know that in case of meningitis, the patient will be having this Brudensky sign. While lifting the neck, automatically, while lifting the lower lip, automatically the neck flexion will take place. I will show the image. Okay, so this is called as what? Brudensky sign. It happening because of the inflammation of the meninges. The meninges is getting atrophy. Shrinking of the meninges will be causing what? Kerning sign and Brudensky sign. The next one is red Steinberg cells. What is red Steinberg cells? Commonly seen in Hodgkin's lymphoma. Multinucleated owl's eye appearance will be there. I will be showing the image. Okay, and leukocoria. What is leukocoria? See, leukocoria is also called as cat eye reflex. What is that? Cat eye reflex. Okay, so while you are taking the photo of your baby who is suffering from retinoblastoma, what is that? Retinoblastoma. That is the cancer of the eye. Okay, so if you are taking the photo of a baby who is suffering from retinoblastoma, that time the photo film, white pupil will be visible. Understand? So that condition is called as cat eye reflex. It is also called as leukocoria. Now I will be showing all the images. Don't worry. Okay, so you can see here. So option D, leukocoria is the right answer for this question. Okay, I have given the rationale very clearly. Retinoblastoma commonly present with leukocoria. Retinoblastoma is nothing but cancer in the eyes. So while taking the photograph, if you are seeing white eye reflex or cat eye reflex, that is the condition seen in the retinoblastoma. The cat eye reflex is also called as leukocoria. Understand? So rest of the options, whatever I have explained, everything is given here. Brush field spot commonly seen in the Down syndrome patient. It is nothing but white or gray spot on the iris. Brudensky sign, we already know that involuntary flexion of the hips and knees when the neck is flexed. Okay, indicating meningeal irritation. Red Steinberg cells, binucleated owl's eye giant cells commonly seen in the Hodgkin's lymphoma. These things I have already explained. I will show the images. See, brush field spot. You can see here, this is called as what? Brush field spots. In brush field spot, what is happening? Whitish or grayish spots in the iris. This is called as what? Iris. Iris is the one which is deciding the color of the eye. Understand, right? Whether it is a black color, brown color, green color, blue color, every color of the eye is determined by the iris. So in the iris, if you are seeing the white or gray spot, it shows that the patient is suffering from brush field spot. That is commonly seen in the Down syndrome patient. The next one is, you can see here in Hodgkin's lymphoma, multinucleated Bowles, owls, OWLS, owl's eye appearance will be there. You can see multinucleated or binucleated owl's eye giant cells is seen in the Hodgkin's lymphoma. That is nothing but this is the one. Understand? And this one is the Brudensky's neck sign. Okay, while flexing the neck, automatically the lower leg, hip, and lower leg, it is automatically flexing. That is called as what? Brudensky's neck sign. And this is the leukocoria, that is cat eye reflex. What is that? Cat eye reflex. Okay, you can see the white pupil reflex. Okay, while taking the photograph along with the flash, you can see the white pupil reflex. Understand? So these are all the images. See, image-based questions also very common nowadays. You can get the image-based questions. So just capture these images. Okay, fine. So the next question is, a patient is in the post-operative ward after undergoing mastectomy. During the first 24 hours, the nurse encourages gentle exercise to prevent the stiffness without putting stress on the surgical site. Which exercise is most appropriate? See, two type of questions similar to this mastectomy procedure they have asked in the exam. One they are asked in the ESI exam, another one in the RRB examination. Okay, so I have added both the question. We will discuss about these two things. So in this question, I understood that the person is undergone mastectomy procedure. After undergoing the mastectomy procedure, only during first 24 hours, what kind of gentle exercise they can do? So this is the question. So which exercise is most appropriate within 24 hours of mastectomy? So this is the question. So four options they have given here: hand wall climbing, pendulum arm swing, elbow flexion and extension, shoulder abduction and external rotation. Four options they have given here. Within 24 hours after mastectomy, what is the suitable procedure, gentle procedure without giving any stress to the surgical area? So hand wall climbing. So definitely hand wall climbing means if you are lifting the hand, so definitely it will create a stress over the surgical area. So you can eliminate that option. The option B, pendulum arm swing, we will discuss about that later. The next one is flexion of elbow and extension of elbow. So this one will also cause what? Stress in the surgical side. Shoulder abduction and external rotation. See, abduction means just away from the body. So definitely it will also cause what? Uneven rotation also it is there in the option. So these two things again it will cause stress over the surgical side. So which is the leftover option? The leftover option is pendulum arm swing exercise. So here within 24 hours after mastectomy procedure, a gentle procedure what we supposed to do is pendulum arm swing exercise. So this is the image of the pendulum arm swing exercise which is done after the mastectomy procedure within 24 hours. After 24 hours they can go with the hand wall climbing, elbow flexion, extension, abduction, adduction of the shoulder, rotation of the shoulder. After 24 hours they can go all these things, but within 24 hours only a gentle exercise has to be done, that is called as what? Pendulum arm swing exercise. So this is the image of the pendulum arm swing exercise. Okay, fine. So let's move on to the question number 23. A patient with a frozen shoulder. Key point, first key point. Frozen shoulder is advised to pendulum exercise. Again the same pendulum exercise by the physiotherapist. The nurse explained that this exercise involved gravity assisted movement without active muscle use. These exercises are classified as. So what type of classification this pendulum exercise is? So this is the question. Pendulum exercise is coming under which classification? Okay, whether it is an active exercise or passive exercise or assisted exercise or active assisted exercise. So what type of exercise is pendulum exercise? So two questions, similar question, but they have asked in different pattern in different examination. So this is how they will ask the questions in the exams. Okay, fine. So pendulum exercise, so you can see the image. So it is working based upon the gravity. So here there is no stress for the surgical site. So here this is a passive exercise. Okay, it is not an active exercise or assisted exercise. It is only a passive exercise which is working based upon what? Gravity. Okay, there is no stress to the what? Surgical area. Okay, so here the right answer is option C, that is passive exercise. The next question is, a nurse is teaching a student about the effect of space travel on human body. Effect of space travel on the human body. She explained that the absence of gravity leads to weakness. Absence of gravity, underline the key points, okay? Absence of gravity leads to weakness and wasting of certain body tissues during or due to lack of resistance. Which body parts becomes very weaker in the space? So last line is very important. Which body part become weaker in the space? See, if a person is traveling to the space, the gravity will not be there. Okay, so in that case, which body part will become more weak? So this is the question. Leg, brain, muscle, and 4 options. See, just imagine if you are traveling to the space, the gravity will not be there. You will be floating on the space. So what is the purpose of the muscle inside our body? See, the muscle is the one which is bearing the weight of our body, which is very, very important for all the activities of our body. But in the space, there is no use of the muscles because the body weight is beared in the space. Okay, so here what is happening, the muscle is going to get atrophy. Muscle wasting is going to take place in the space. Whereas leg, brain, hands, these things, there is no changes will happen. But in the muscle, what will happen? The muscle atrophy will take place. Muscle weakness or wasting will take place. Okay, so here the right answer is what? Option C. Okay, the next question. See, image-based question can be asked like this. Very important. Already image-based question asked in the exam. Okay. So look at the image. I will explain about the image. A patient complains of difficulty in lifting the arm and the nurse notices winging of the scapula. So this is called as what? Winging of the scapula. What is this? This is winging of the scapula. So during examination, the nurse noticed winging of the scapula. The physician suspects injury to a nerve supplying the serrator anterior muscles. See, serrator anterior muscle is the one which is maintaining the structure of the scapula like this. Okay, so if the serrator anterior muscle is paralyzed, that time this kind of winging of scapula will take place. So this serrator anterior muscle is supplied by a special group of nerves that is called as what? So this is the question. Understand? So this winging of scapula is happening because the nerve which is supplying to the serrator anterior muscle is affected. So which nerve is supplying to the serrator anterior muscle? So this is the question. Dorsal scapular nerve, ulnar nerve, long thoracic nerve of Bell, torso dorsal nerve. 4 options they have given here. You know about ulnar nerve. Ulnar nerve is the one which is causing claw hand. C-L-A-W, claw hand. Claw hand. The little finger is going to get affected. See, so you can eliminate the B option. And here, thoracodorsal nerve and dorsoscapular nerve, it is not supplying the serrator anterior muscles. So which is the leftover option? So here the right answer is what? Option C, long thoracic nerve of Bell. This same question asked in the NORCET examination. Understand? So which is the one which is supplying the serrator anterior muscles? Long thoracic nerve of Bell is the one which is supplying the serrator anterior muscles. If it is getting damaged, the long thoracic nerve is getting damaged, that time it leads to winging of the scapula. Okay, fine. So the next question is, a child is diagnosed with a congenital deformity where one shoulder appears elevated and the movement is restricted. The doctor explains that the condition is related to abnormal development of the specific bone. Which bone is involved in the Sprengel's shoulder? See, they have given very clearly, it is a direct question. They have said very clearly that the shoulder appears elevated. One shoulder appears elevated. One shoulder elevated, another shoulder is normal. Okay, fine. So this kind of appearance is called as what? Sprengel's shoulder, because one bone is abnormally developed. So which bone is abnormally developed? 4 options they have given here: scapula, radius, ulnar, tibia, and here they have given one good key point, that is Sprengel's shoulder. Okay, so this Sprengel shoulder is the one commonly seen if there is a problem with the scapula. So which bone is affected here in the Sprengel shoulder? The scapula is affected here in the Sprengel shoulder. Okay, because of this there is an abnormal elevation and restriction of the movement in the scapula. Understand? So let me show the image also. This is the one. This is the Sprengel's shoulder. One shoulder is totally normal. Here the scapula is also totally normal. Whereas here you can see here this scapula is elevated and the movement of this shoulder is restricted. So in this condition, it is called as what? Sprengel's shoulder. Image-based question can come in the examination. Okay, right? So this is called as what? Sprengel's shoulder. Question number 27. A 5-year-old child with the head injury is admitted for observing after falling down from the bunk bed. The nurse continuously monitors the sign for increased ICP, which finding indicate the late sign of increased ICP. Last statement is always very important. They are asking about the ICP. You all know the normal intracranial pressure is 5 to 15 mm of mercury, and here the intracranial pressure is increased because of head injury. So here they are asking about the late sign of increased ICP. Late sign of increased ICP. 4 options they are given here. Bulging fontanelles, dilated scalp vein, nausea, widened pulse pressure. Guys, bulging fontanelle, dilated scalp veins commonly seen among the infants. Okay, and it is a yearly sign of ICP, increased ICP. It is not a late sign. It is a yearly sign. One more option is given here, that is option C, nausea. See, nausea and vomiting is also a yearly sign of increased ICP. So option A, B, C, all these three things are coming under what? Increased ICP condition, and it is a yearly sign of increased ICP. And the last leftover option is widened pulse pressure. So widened pulse pressure is the late sign of increased ICP. So here the right answer is what? Option D, that is widened pulse pressure. Okay, you can see here I have explained about all other options also. Just pause the video and just go through it. Let me compare the yearly and late sign of ICP. That is very important for your examinations. Okay, you can see the comparison. Yearly sign, it is also called as compensatory phase. Late sign, also called as decompensatory phase. So in yearly sign, what are all the signs are there? Headache, nausea, vomiting, irritability, restlessness, decreased level of consciousness, blurred vision or diplopia. So these are all commonly seen as a yearly sign in case of increased ICP. What about the late sign? Widened pulse pressure, bradycardia, irregular respiration. All these three things are collectively called as what? Cushing triad. Cushing triad. In Cushing triad, three things are there. Widened pulse pressure. See, the increased blood pressure will be there and the widened pulse pressure will be there. So what is widened pulse pressure? The gap between the systolic and diastolic will be more. What is the normal systolic and diastolic pressure? 120 by 80 mm of mercury. But here in the widened pulse pressure, it will be around 160 by 60 mm of mercury. There is a huge gap between the systolic and diastolic pressure, and the blood pressure will be in the higher end. That is called as what? Widened pulse pressure. Along with that, bradycardia, irregular respiration, all these three things will be collectively called as what? Cushing triad. Apart from this, fixed and dilated pupil will be there. It is also coming in the late sign. Decerebrate and decorticate posture will be there. Decerebrate means abnormal flexion and decorticate means abnormal extension. So these signs will be there in the late signs. Understand? So you have to be very careful in while reading the question what they are asking. They are asking the yearly or late sign. According to that, you have to answer. Okay. So next, move on to the next question. A patient with a severe burns. Yes, this question recently asked in the NORCET examination. A patient with severe burns is receiving silver nitrate dressing in the burns unit. During monitoring, the nurse checks electrolyte levels. Because prolonged use of this silver nitrate dressing may lead to depletion of which electrolyte. So if the patient is always using the silver nitrate dressing because of severe burns, their patient is receiving silver nitrate dressing continuously, means which electrolyte depletion will take place. So this is the question. Blood gas abnormalities, abnormal blood count, sodium and potassium depletion, increased blood urea nitrogen. So they are asking about depletion, then how the increased blood urea nitrogen will be there. You can remove this. And they are asking about electrolyte, right? So abnormal blood count, it is not at all related. Blood count means WBC, RBC, platelet will be there. So here electrolyte will not be there. You can remove this one also. In blood gas abnormality, see, blood gas is totally different and the electrolyte depletion is different. So you can remove the option here also. So the leftover option is option C, that is sodium and potassium depletion will be there in case of silver nitrate dressing in the burns unit. Understand, right? So here the right answer is going to be silver nitrate dressing will cause sodium and potassium depletion. What depletion? Sodium and potassium depletion. In severe burns all over the body, they will apply the silver nitrate dressing. So this silver nitrate dressing will absorb all the sodium and potassium so that in the blood, the sodium and potassium level will be decreased. Understand, guys? So question number 29, again, very simple direct question asked 2-3 times in the exams. Yes, psychology students ask the nurse educator how memories are stored in the brain. The educator explained that the memory trace remains in the brain as specific physical or biochemical changes. These memory traces are called as engrams, pictures, signals, and diagrams. See, whatever we are studying, whatever we are learning, all those things are stored in the brain in the form of some biochemical changes. So the biochemical changes, physical or biochemical changes, that is the key point. Understand? So whatever we are studying, whatever we are learning, all these things are stored in our brain in the form of biochemical changes. These words are present means that is called as what? Engrams. So here the right answer is what? Option A, engrams. Okay. So the next question. A nurse is teaching about the nerve impulse transmission in the nerve system. She explained that the impulse travels from one neuron to another through a specialized junction between the nerve cells. This junction is known as. Very simple question. The right answer is option D, that is synapse. You all know that, right? Fine. So we have discussed almost 10 questions. All these questions are already asked, frequently asked many times, even though it is simple. Okay, still they have asked many times in the examination. So don't think this is a simple question. This is a moderately tough question. This is a tough question. See, all the questions are very important. Mostly the students are making mistakes in the simple questions. Okay, because there will be some twist in the questions. Okay, so please watch the video, revise your content again and again. Okay, and if you have any doubt anywhere, you can drop your message in the comment section so that you can understand what is the exact thing is there in the question. Okay, so thank you very much for watching the video. And from the Metier side, continuously we are giving regular courses and crash courses for the students who are appearing for competitive examination like NORCET, RRB, PGI Chandigarh exams, SGPGI. So continuously we are giving support to the students. And if you want to clear the exam in the first attempt, please contact us, and the details are given in the bottom. Please contact us in this phone number. Okay. So thank you very much for watching the video, and all the best for your upcoming exam.